Morning, Dr. Sean. How are you doing?
Yeah, good. How are you?
Very well, thank you. Very well. Thank you for your time.
Nice.
Today we're going through an awesome case review, an awesome article that was published just recently on sleep and anxiety disorder following, or resolution of those following the reduction of vertebral subluxation. So we'll jump right into it. I suppose the first question is vertebral subluxation. What is it?
Well, this is what we find when we're assessing you in the clinic here. We're looking for areas of dysfunction where we're seeing neurologic changes and muscular and musculoskeletal changes in the body. And yeah, this is what we're correcting.
Yeah, basically, we try and keep it really basic. I try and use, analogies like, how the brain is talking to the body and what the body is telling the brain and how the nervous system is functioning. Because really, when we're talking about the nervous system, it can get quite complex. I think, and people can get lost with regards to the complexity of it. So we definitely don't want that. Now, the second thing too is resolution of sleep and anxiety disorder. So this person who received chiropractic care in this article here, it came out as a press release as well. So um, basic press is social media, I suppose, these days. We don't have any newspapers anymore. They used to come
Mm.
out in those, but definitely in journals. So a 28-year-old female presenting for care with complaints of musculoskeletal symptoms, sleep disturbance, and anxiety disorder. So, why would we be getting sleep disturbances or anxiety disorders when we are subluxated? What is it? What is it that's going on in the body?
Well, it's just that disconnect between receptors providing feedback to the brain. So the brain relies on that feedback to stimulate areas of the brain. And if we're not getting the correct neurological information in, then yeah, our output struggles, and we can see a whole host, an array of different symptoms present. And sometimes that can be anxiety, sometimes it can be trouble sleeping.
It is a disconnect. One of the things I find in practice with many of my shift workers, patients who are shift workers, the sleep disorders are quite considerable. I think it's because of the circadian rhythm of sleep. The amount of hormones that are let out when we're going to sleep or when we're waking up. If we're not going to sleep when the sun goes down or not waking up when the sun's coming up, the body's hormones change, the cycles change,
Mhm.
how we function totally changes.
It's
And so a
chaos.
bit chaos. I was going to
Yeah.
use I was going to use a bit of disconnect, a bit of not quite working correctly, not quite tuned, but yeah, you're right, chaos. That's exactly right. So this person was assessed using um, chiropractic assessment, radiographic analysis, autonomic adaptive abnormalities were found. So all these technical terms basically telling us that the body wasn't working correctly under the control of the nervous system. Now, the reduction and correction of vertebral subluxations, the schedule that this person was under was twice weekly, getting adjusted twice weekly for a duration of 3 continuous months with a progress assessment after that. Now, the patient reported subjective improvements in both musculoskeletal and non-musculoskeletal complaints, which i.e. is the sleep improvements and the improvement in her anxiety as well. So why would we get musculoskeletal improvements as well as those things that aren't musculoskeletal? Why would that happen?
Yeah, well, same thing as before. It's the brain relies on that feedback from the receptors that are passing through the joints and the nerves as they enter the spine.
Hmm.
And if we've got an area where that information coming from those receptors is giving faulty feedback, then the brain is going to struggle to control the muscles that are connecting to those joints, and then the muscles that are supplied by the nerves running through those joints.
Yeah, correct. And often musculoskeletal issues can be quite we can feel them. We can they affect us
Very
quite
obvious.
considerably. Yeah, very obvious. Yep, exactly. But there's also things that the nervous system is supplying that aren't obvious. And these are trillions and trillions of things that are happening underneath the surface that you can't see obvious signs and symptoms of. Um, and I think one of the key aspects of this, when we're talking about, things like sleep, anxiety, etc., it also incorporates organ systems, glands, blood vessels, etc., things that you can't feel. The nervous system is supplying things like that as well. So,
Mm.
some people leave their health to how they're feeling. Like, if I'm feeling good, I'm healthy. Whereas what we should be doing is like, well, how you're feeling is an indicator of how well we are, but it's not the true indicator. True indicator is function. The true indicator is how well the nervous system is communicating with the body. Is it communicating as well as it possibly can? Are there other things that can be happening as well? Yeah, it's quite interesting. And I'm sure you get in with your patients as well, when we deliver the chiropractic care and improvements happen in the musculoskeletal realm, or
Mm.
things happen which are obvious that improve.
Straight away.
Um, yeah, yeah, and my patients will tell me things like, yeah, sleep's improved, or state of mind's improved, or how I'm feeling generally, in life improves, because the brain and the body are more connected and working correctly. You get that too?
Yeah, of course.
Yeah, I think all chiropractors do that, and that's what really keeps us motivated and continuing to stay up to date with regards to our training and research and everything like that. So, look, it's pretty technical, Dr. Sean. I know you and I go through this, and we talk, Pittsburgh Sleep Quality Index and the Hamilton Anxiety Questionnaire and everything. So if anyone wants to see those as part of this case, you can have a look. I'll post the links, so you can have a look at the article and the results as well. But you probably
All
don't need
the fun stuff.
to. Yeah, exactly, all the fun stuff. The basics are the basics. Just making sure the nervous system is working well, and then we basically trust the body's healing and adaptive ability to come forward and to keep us healthy, regulating and healing things that need to be done. So, finally, Dr. Sean, I do want to talk about stress levels and how subluxations are caused by and are affected by stress levels, basically physical, chemical, and or emotional in those categories. Just a few comments about that.
Wow, stress we know affects us so dramatically, but it affects the brain. And when we go into a stress response, it creates those changes to the parasympathetic and sympathetic nervous system. And it's all about that fight flight. And when you're in that situation, you start shutting down your areas of the body that you don't need in a fight flight situation. And that is the areas that control your sleep and your rest and your digestive system, your reproductive system, all these areas that should be functioning optimally, 99% of the time. If you're in that stress response, they're all going to be suppressed.
Yeah, absolutely, because there are certain functions in the body that need to be working when we're stressed, and there are functions which don't need to be working when we're stressed. And that's part of the different systems. And those systems, like, I probably simplify them a little bit too much, but I like to call them, some things are turned on and some things are turned off, but it's more complicated than that. But yeah, I mean, after an adjustment, most people tell me that they feel better, they're more relaxed, they just feel in a better state. And that's partly because the adjustment will work on not only the sympathetic system, but the parasympathetic system, which is the rest, the repose, the healing part of our nervous system. And it's very, very powerful.
The
Oh, yeah.
rebalancing.
Sorry?
The rebalancing.
Balancing. Yeah. It's all about balancing how the brain is connected and talking to the body, isn't it? Making sure that it's doing the right thing. Very cool. All right. Thank you for your time today, Dr. Sean. Thank you
Thank
for your
you.
wisdom with regards to when we go through articles and research, etc. It's always good just to get that other perspective. Any questions that anyone has out there on this research or anything else with regards to chiropractic care, don't hesitate. Contact us, email us, give us a call. We're here to help. Thanks, Dr. Sean. Have a good day.
Yeah, you too.
See you, everyone. Bye.